that's about it that we're doing. If anybody has any questions, I'd be glad to answer them.
Hey, Mary, this is Karen.
Yeah,
Karen Carney from the Blue Ridge Independent Living Center in Roanoke, Virginia. We are all teleworking, which for us is a new experience. And some of us who live in very rural areas, like me, are having a difficult time maintaining an internet connection that is reliable. I'm sure nobody else is experiencing that, but I'm kidding. We have unfortunately heard from some of the home modification programs that we offer that all work is to cease, which is very problematic for our consumers, but we certainly understand that we don't want to risk consumers' health and or the contractors' health, but that's been a little bit disconcerting. So some staff are in the office on certain days. We made up a schedule so people that were concerned about being with other people, we could ease those concerns for them. So we have a schedule. Somebody's in there in the morning, somebody's in there in the afternoon. We have people checking our voicemail messages remotely and then emailing staff about consumers that they need to contact. And so we're just trying to do as much as we can for our consumers. We also did get notice from our Department of Medical Services that face-to-face meetings did not have to occur, that we could do those things by telephone. So we're taking advantage of that, but just trying to adjust to the new reality that seems to be changing every hour. I don't know if anybody has any questions.
Hi everyone, this is Sarah Martinez from Access to Independence of the Eastern Iowa Corridor in Iowa City. And to our last speaker, I am also having technical difficulties at our center. We ordered laptops to be able to transition everyone home from by today, and I learned that they got returned to sender. So we had to restart our order all over again and have a couple of staff who are still technology to work from home, which I hope that other people's transitions are going a little more smoothly. We have decided to keep kind of the same check-in and staff meeting schedule as we did when we were together in the office. So we are doing one-on-ones with staff during their scheduled time, and then we have a 2-hour staff meeting on Fridays that we're going to maintain. And staff and I have a very small staff of about 4.5. So we use Google Chat and text messaging to kind of maintain communication, and email to help share any kind of resources that we see and news. We have been compiling all of the resources that we get on our website, which makes a really nice landing page for community providers and our consumers to go through and see what they need. So that could be like financial resources or unemployment insurance. And we've also tried to provide ASL, as I know a lot of advocacy has been done in our state and across the country. Press conferences and any kind of informational meeting has ASL interpreters present. We're also working on rolling out programming virtually through Google Meet, and then also phone conferences, so that we can continue to provide peer support and our self-advocacy groups. And we're also working with local small businesses, yoga studios, to help provide recreational activities. We're also exploring grants that are being deployed for emergency response to COVID-19. See if there's an opportunity to get people the technology they need to access these virtual services. So whether that's integrating cell phones or getting maybe some like Chromebooks. But as everything is going to on demand, I'm really concerned about, you know, isolation and making sure that there's adequate technology to access these services.
Thank you so much for sharing that. I think if you don't mind, I'd like to ask a group a question from the chat. Seth is wondering, has anybody, has anyone done a telehealth appointment for a consumer who wasn't already doing telehealth appointments before COVID-19?
Sorry, can you re-say the question?
Sure. They're asking if anybody has done a telehealth appointment for a consumer who wasn't already doing telehealth appointments before COVID-19. Are you having difficulty with it? Are you wondering about getting them to use the service, or can you expand, Seth?
Hi, this is Audrey from the Center for Independent Living, Accessible Resources for Independence, serving Anne Arundel and Howard counties in Maryland. So I'm not sure if I'm understanding the question totally, but I wanted to respond so you have a response. I'm not sure in what maybe it's just. Maybe our center is in the minority, but I mean, we're not a Medicaid provider or anything like that, and we don't provide any, health, services that would be billed through insurance or anything like that. So no, we haven't done telehealth, although we are trying to do, video chat and stuff like that for peer support.
Awesome. And how's that going for
I don't
you?
know.
Oh.
We're still getting up and running with it. Google Hangouts is, has like a free service now for, I think they're like their premium version. So I'm trying out that. We also provide pre-employment transition services, self-advocacy training, which is where most of our income comes from. So not being able to meet with people one-on-one, because things are pretty much shut down here, is going to be really challenging for our budget. So we're working with Google Education Suite to try to, which is free right now as well, to try to get some kind of online training that we could bill for.
Audrey, have you considered like doing a Facebook page for your students and maybe doing like Facebook Live videos, since that might be a platform they'd have access to?
That's a good idea. So a lot of the people that we serve don't use Facebook, but stuff like Instagram, I've considered, or, they use Snapchat, but that's kind of a seedy platform sometimes. So I don't know if I want to use that, but I think that would probably be effective. I just don't know what our requirements are in terms of confidentiality, if HIPAA applies or anything like that.
We made a piece of information for virtual teleconferencing that is simply a yes or no that they need to respond to, that our consumers understand that we are trying our best to uphold confidentiality through virtual platforms, but we can't guarantee that there aren't family members or other people present in the household while these services are being delivered.
Awesome. Would you be willing to share that?
I would be happy to.
Okay, great. I'll put my email address in the chat. Thank you.
Wonderful. And Sarah, if you don't mind sending that to me, Mary, I'd be happy to also send it out on the listserv as well. We can stick it up maybe on the ILRU stuff and the April stuff.
Will do.
Awesome. Thank you so much for sharing that. I wanted to double back around for the question that we had around telehealth, he is really wondering, what they're trying to do is, sorry, I lost my, they're going to try and enroll folks into their provider's telehealth program for video appointments. Is it Leah Ward? I see that you're helping consumers now. Do you have any advice for Seth as they move forward with that? And if you press your microphone, you can unmute.
I was just looking for some general feedback too from the group, if anybody has had barriers or had any recommendations for navigating that process. I haven't had any, so it's something I anticipate we're gonna be doing, because pretty much all of our providers are, they've shut down to actual face-to-face patient visits. So how else are people going to access their doctors? It has to be done either by video or over the phone. So I'm not really sure.
No, that's why we're here. That's awesome. I think let's keep asking the question, and if somebody has thoughts, please feel free to throw it in the chat or pipe up. We can also collect all these questions and try to find answers to them as well throughout this process. This is all new to all of us. So.
Mary, it's
Yeah.
Karen again. I was going to suggest that if we could put together a list of the different platforms that people are using to do some of the things that they're doing, that would be extremely helpful.
That is a wonderful idea, Karen. And I don't know if I'm even, if I should even say this yet, but we're working with Judith and some folks at ILNet to put together an FAQ on telecommuting. And so I think that's going to be, that's a great idea to add in there. I know a lot of people doing Google Hang and Zoom, and we'll definitely start to try to pull that together.
Appreciate it.
Yes. Josh Whitmer at Disability Rights and Resources in Birmingham says they tried really hard to keep resources available through social media. We're also trying to develop peer support groups to keep in touch with needs. And then we've got Sue. Oh, just one second, baby. I'm sorry, you guys. We've also got Sue, who says part of our staff are working from home with remote connections to their office computers. We do have staff in the office working also. Just a minute. Contacting consumers, assessing their needs, finding community options and resources. We're using Zoom for staff meetings. We're using Google phone numbers and emailing back and forth to each other. Internet connection is a concern, but it's functioning pretty well. Offering options to consumers with current family health, veteran services, etc. That is such a great idea. So somebody, oh, Sarah actually figured out how to drop it right into the chat. If you guys see that, she's got her authorization right there. You can download it right from the chat. They mentioned a Google phone. I just wanted to throw out there while folks are getting together, people have been asking me, how do I telecommute from home? And that's one thing that I suggested. A Google phone number is a way that your folks can call consumers from home, but it's not actually traced back to their personal phone number. It's a nice way to kind of keep, keep those boundaries. Also, I don't know if folks have heard of DigiSign or DocuSign, but those are nice electronic ways that people can sign paperwork. So just a couple of little techie tips for you guys. We're gonna work to pull some of those together and send out. But who else would like to share either a question that they have for the group or what they're currently doing?
Mary, this is Beth with Walden Options in South Carolina.
Hi, Beth.
Hi. We have two offices, one in North Augusta and one down in the Low Country, which is the office I'm in. And I know that our staff in the North Augusta office have been alternating days where there's no more than 2 staff members in the office, and they're in various parts of the building. So like one works in the back part of the building and one works in the front part of the building, so that there is like total space and distance between them. And then in my office, I live 2 miles from the office, so I've just been going in because there's nobody else in my office. But we've been doing like our staff meetings via go-to meetings. We've been having those, and then we have like a group text going. So we actually forward our phones from the office, like they are forwarded to my cell phone, and we're also using like the Google number. So if I have to call consumers back, then we have that option to do that. But my question that I would like to ask, I mean, a lot of what we do is we go into the school systems and we're working with students doing career boost programs and transitions. And we just got hit with it, with the governor of South Carolina closing our schools through the entire month of April. So they won't even step foot back into a classroom. And the area that I'm in is very, very rural. And a lot of the students don't have the resources or internet connections at home to be able to access any materials that we were to send them. So if anybody has suggestions on how to go about getting the information so that our students can continue on their curriculum, and you know that we're not, because we teach in a 13-week program one semester and then another 13-week program, so we don't want to lose the progress that we're making with these students or with our other consumers that we're working with transition.
Great question. Does anybody have thoughts for Beth?
Hi, my name is Cher, and I'm calling from Madison, Wisconsin. I work at Access to Independence there. Can everyone hear me?
Yes.
Yeah.
Okay, good. I thought I was muted for a minute. Our schools are also closed, and we just found out that some students, maybe not all of the schools, and we're looking into that, they're doing remote learning, where the kids are issued like an iPad or a tablet or something like that, and then they're exchanging documents through Google Docs. And we wanted in on that because we also do transitional classes, like a skills to pay the bills type of class. We also have like 13-week courses. And all of that was put on hold when the kids were done with school. So we just got word yesterday that a couple of the students, and we have something called Project Search up here for transitional students. They are also going to be doing the telelearning. And you might be able to find out if that's an option in the different areas. It couldn't be the only place. Madison isn't that gifted.
I do know that one of our counties is probably, I think, rated one of the most impoverished counties in the country. So they're very, very rural, and I don't even know that they have internet service as far out as they are. So that, I mean, that would be the one thing, because I taught in Georgia prior to coming here, and we were able to do Edgenuity to be able to do that, and the Google Classrooms was a great way. But I'm trying to reach out to the teachers of the classes to see what they're doing for the other curriculum besides the curriculum that we present, how the regular learning is going about that.
That's a great question. Leah in the chat said, in New York, our broadband internet and cable company expanded free service to families with students who didn't have internet. And I think Justice dropped a link in the box as well that might be going on in lots of areas. Perhaps that's something the SIL could help these folks get access to internet. The other thing I just wanted to mention is, I know it's real old school, but maybe the teachers, if you printed out your slides, maybe they would send them to the students. And then you guys could just meet on telephone and talk about the slides that they're each looking at on their own if they don't have access to internet.
Okay, that was something that we'd actually thought about doing, and because the school districts here are sending buses out every day to the students to deliver lunches and food to them, sending the packets out with the bus drivers as well, so that those students are getting that material. But we have to make sure that it's in a format that they're that's accessible to their needs.
Right.
So, but thank you. Those are fantastic ideas, and I really appreciate everybody's ideas and inputs. Thank you so much.
Yeah, Beth. Real quick, just from the chat, I wanted to go back to talking about some of the ways we can connect. DAC user says that they're using Discord to keep employees connected from home in the office. It's super simple. Is Discord kind of like a Slack or an information channel? Let's see if he types anything. And Sarah says she's from New Vistas in Santa Fe, New Mexico. At New Vistas, we're using increased telehealth to support our services. Platforms we're using include Zoom, Skype, Google Hangouts, Doxy.me, and FaceTime. All these platforms have problems based on connectivity, but we have successfully used them for telehealth visits for our early intervention program and are looking to see how we can expand it for our IL advocates. Oh, great. Thanks, Sarah. That's great info, I think.
Hi, this is Molly from Disability Action Center about Discord.
Hi.
We have a young gal up in our Spokane office who is a gamer, and this is a old setup gaming platform that gamers use, but it's super stealth and super simple and super easy to set up. So our offices, each person we have 4 offices. So we're all set up, and at any time we can post let me read you a couple of our categories here. We have a question section, we have a general section, a request section, CIL suites information, resource section. So we're sharing stuff all the time between individuals who are working from home or still working in the offices. Some of us are able to still come in. What I found really nice about it is, because I'm not a gamer, I'm a little bit older, it's super simple. I caught on super quick. And there seems to be no streaming issues with how fast it works. So it's just Discord app, and we just all uploaded it. Somebody was, of course, the main person, but you can chat at people in the whole group. Our whole office can chat with each other, or we can reach out and just say at so-and-so and just personally talk back and forth to them. It's very smooth. And there's a voice video option.
Awesome. Thank you for that info. I also just want to, our youth coordinator just reminded me that we'll be having one of the ILNet Youth Coordinators Connect calls on April 7th, and you can find that info on our website and on ILRU. And that's going to be all youth coordinators brainstorming ways to engage youth through this time. So that might be something to consider as well. Great. I have Mary Reynolds from Skill in Parsons, Kansas. They said that they're not on a state or city order to shelter in place. They're taking precautions by keeping their doors locked. Many of our staff are working at home. A few are still coming into the office. We're basically on a safety plan. I also wanted to mention we had some folks from Ann Arbor that said that they're using Blue Jeans, which is HIPAA compliant, and it's been working very well. And then Seth mentioned that GroupMe is also a good communication app. You guys, I'm learning a lot right now. That's great. I wanted to go back up also, not to completely switch gears, but Brett is from CIL DRC, and they serve Northwest Florida, and hurricane season is around the corner for them. Has anyone considered where people should go in the event shelters are closed during a hurricane or other catastrophic events, such as fires in California, tornadoes in the Midwest, etc., due to the coronavirus? Ooh, I haven't even thought that far ahead, Brett, but has anybody else thought about what that might look like?
No.
Well, I
think we've
think
been so focused on this, on the, corona. I mean, we've really been focused on the coronavirus response as sort of an emergency response issue. And so, I mean, for example, all of the emergency shelters that open during disasters are open now. So it's sort of like the infrastructure that would be in place in response to a disaster like that is in place currently. If it were to get blown away by a hurricane, I mean, I don't know. I mean, I guess they would just have to move it, because right now, I mean, that stuff here, they're already, it's set up, it's erected, it's there. So yeah, it's an interesting question. But I guess they would do whatever they would do in a situation where they had, like, let's say there was a hurricane and then there was another storm or something. I don't know.
I think your point is taken well, that I think right now we're all kind of focusing just on this shift. But definitely I think that's something we'll have to start considering moving forward. Thanks for bringing it to our attention. I also wanted to just mention quick a couple of things about technology in rural areas. One is that Leah says, have you thought about utilizing the Lifeline benefit and applying that to a mobile hotspot? I actually don't know what that means, but they said that a lot of cell phone providers are waiving unlimited fees, and maybe a smartphone hotspot could help in some of those situations of those rural areas. And Jean Hall from Kansas says that they are reaching out to ACL to let them know how big a problem the lack of broadband in rural areas is affecting people with disabilities during this time. And Jean, I can bet you I think ACL knows that, but it's good to reach out. Hotspot jetpacks, Brian says. That's great. All right, I think Bill says in Montana, all 4 CILs have closed their doors and are having their employees work from home. I'm not sure how well that's working. For teleconferencing, they're using Zoom. They've hosted listening sessions for the spill via teleconferencing. Attendance at those was not as robust as face-to-face. The Silk operates primarily through phone calls and teleconferencing. Since I'm employed by the state as the Silk program manager, we're also using Skype for business. I'm still working out of the office, but I'm preparing to work from home shortly, which means setting up a home office and getting secure internet access from my home computer. Wow. So what else, folks? What other questions are you wondering about that you want to ask for your peers?
Hey, Mary, I have a quick question.
Yeah.
First, where are you? Because that looks amazing.
This is a picture that I took from the top of Waterworks back when we could go outside and things.
Good to know. I had a question for folks. Are consumers receiving accurate information about COVID-19? and how service providers are responding to that?
Actually, that's an interesting question because we had initially, I don't know if you recall, when I first started talking, I was talking about how we had set up a list of resources. And initially what we did was we took the information that had been put out by the different, we have 3 different counties, different health departments. But then what we realized is that information is fluid. So it's changing every day. So instead what we have is we've created a link to that information because it changes in real time. And so that link is available for both us to provide to consumers that have internet access, or for us, or for our staff to be able to look up, while they're, contemporaneously while they're on a phone call with a consumer. So now one of the other things that I was that came into my head when people were talking about some of the challenges of reaching students who are more rurally located. So students with disabilities, there's an argument that could be made that they could overnight any written materials to students with disabilities that don't have access to internet, and then do the class, the class discussions over a conference call as a reasonable accommodation, because they do have that obligation to provide a free and appropriate education. And, that's why they're continuing to provide instruction at all. I don't know. I was just throwing that out there.
Great. I think any ideas are good ideas at this point, Brian. Thank you for sharing that.
Hey, Mary, can I talk?
Yeah, go ahead.
Hi, this is Scott from Minot, North Dakota, and I'm going to let my coworker who's on here talk in a minute too, because she's the one doing all the work and I don't want to take credit for it. But I think we've done a lot of the same things a lot of people have talked about. We have 80% of our staff working at home, and then the other 2, you can figure out how big our office is, kind of rotating in the office so that we can still get in there and access some of the stuff that maybe you don't have at home, like a copier or things like that. But with that being said, we've been pushing really hard to provide our community with as much information as possible as well. And Taylor, I'm going to let her talk now, and she'll kind of talk about some of the things she's done. And then also we decided last week we were supposed to begin last week by doing some community education to kids with to kids in our elementary schools in our area. And that all got changed when all the schools shut down. So we decided to be a little bit creative. So I'm going to let Taylor talk about that as well. So go ahead, Taylor.
Yeah, thanks, Scott. Hi, guys. Taylor Heine here from Independence Inc. here in Minot. But as Scott mentioned, our community education kind of came to a screeching halt as far as face-to-face and large gatherings go. So we had to get pretty creative and think outside the box, especially when it came to reaching our schools with our elementary ed programming that we have. So we decided to use Facebook Live because right now we really wanted to capitalize on the opportunity that we have to connect with more people than ever before. And so we did a Facebook Live or a Facebook video that premiered. So it showed up on everyone's timelines, or not their timelines, but their news feeds. So they were notified in real time. And then we read a book to kiddos. I don't know if you guys are familiar with the new children's book that just came out called All the Way to the Top. It's about Jennifer Keelan Chaffins now that participated in the Capitol crawl back in the 1990s. And so it did a really great job of describing the movement and how she really influenced the Americans with Disabilities Act. And it really put things or broke things down for kiddos into digestible pieces so they could really understand it. And it had beautiful illustrations. So shameless plug here, if you guys are interested, go to our Facebook page, Independence Inc., a resource center for independent living. And we made sure to try and make it as accessible as possible. So we tried to audio describe. I'm not the best at it yet. Our one of my colleagues, he has a visual impairment, and so he's been training me, but slowly but surely I'm adapting. But anyways, we also have it closed captions. And so we really wanted kiddos and their families, while they're in this transitional period where the school districts are implementing their education on their distance learning. Okay, we really wanted to put out those resources in different educational opportunities for those parents to keep those kiddos occupied throughout this time. And so we read the book and encouraged kiddos to ask questions, and we responded to those questions. And we've had a great turnout with it. So we really want to encourage all of you guys to get involved with that too. And if you can purchase it from your local bookstore online right now, we certainly encourage you guys to do that, or go on Amazon. I can drop a link in the chat for you to access that, but that's been really great. We've also been collecting resources and pushing those out on our social media as well for seniors and people with disabilities to have access to those essentials. So for right now, we just recently put out a post for early shopping hours for people that might be immunocompromised. And for those seniors, we found out that unfortunately Walmart is only providing it to seniors right now, which is very unfortunate. So we did a lot of advocacy last week, been in contact with our headquarters as well as our local Walmart to try and get them to extend those services to people with disabilities as well. So if you guys are interested, please go and contact Walmart headquarters so they can extend that service in your community as well. Let's see, what else do we have going on here? So that's where we're at with resources. Also meal services. So a lot of our soup kitchens are continuing to offer that service in our community. So we've been getting that out as well and updating that daily. And that's been really well received. So I think I kind of covered all the bases here, just getting very creative and thinking on the go here to get out our programming and fulfill our mission throughout this time. Do we have any questions?
Yeah, I was wondering what kind of, I have to imagine that, because like we're planning and doing a couple of, like we're trying to bring Facebook Live into this process. And it's actually kind of funny because the one silver lining in all this is that it's really sort of causing us to be creative in terms of thinking about how we're using our, I'm sorry, my computer's beeping. I think someone's trying to call me. I'll come back. About how we're using social media and technology to reach large amounts of people. And I have a feeling that, you know, we're going to end up using some of this stuff on an ongoing basis even after this crisis is over. So, all right, I have to check something.
Hi, this is Amanda Riekert. I work at ACL, and I wanted to make sure that everybody is aware of the resource page that's located at acl.gov specific to this topic area. And I really want to highlight that because ACL is very much involved in everything they can and should be involved in throughout this process, and so it also is a live resource page, so they're updating it constantly, and it's a really good resource with factual information. And if you want, it's not just about the government; it's about, you know, resources that you could access as well. So I really encourage you to take advantage of that. And if you just go to acl.gov, you'll see that webpage.
Awesome. Thank you. I also just wanted, hi, this is Sierra, by the way. Mary's finding the rural internet right now, which is why it's also maybe helpful to do things as a team. So that way, between two rural areas, you could probably knock it out then. but I wanted to capture some of the comments. There was somebody on here that said they're doing a coffee chat via Zoom. We don't talk about work. We are missing our office interactions, and I have also challenged staff. So I think that is to address how you're supporting your staff through this as well, and self-care. I know that was one of the questions that had come up in the chat earlier. So I love that idea of the coffee chat, because we do, when you're in an office and you can chat about how your day's going or what frustrations you have, or sometimes just the system in general. So that's a great way to do that. Thank you for sharing that. And does anybody else have anything that you're doing for self-care for your staff and making sure that they're taking care of themselves beyond just the idea of physically distancing ourselves from one another, but that mental health piece as well?
Hi, this is Seth from Beaumont. We've been sharing a lot of yoga videos. I know our family has been doing cosmic yoga with our son, and that's been a really good chance to kind of break or reform his idea of what screen time is. Just it's for health. It's not just for fun. And another simple thing we did just for our neighborhood, and I'm thinking about trying it for some consumers that live in the same neighborhood, is my wife worked at a event center, and she had a bunch of shortwave radios that she used at the complex to talk within a quarter mile of each other. And all the kids on my neighborhood street, I gave one to. So every day we meet up and we have a kind of a low tech meetup, and we talk about what's going on in their street and their house, and we just kind of meet. And it's kind of just a fun way to take their mind off it. If you're looking for any family ways to self-care and just something fun to do. But yoga has been the big thing we're trying to push out in the Veterans Yoga Project. Ways for people to start interacting with the technology, to get off the technology and then kind of restore themselves. So that's just some of the ways we've been working through that.
I love that. Did anybody else have anything else you're doing for your staff? Thank you for that. I think yoga is a great way. And then there's so many programs that are offering stuff free right now as well, from little kids all the way up. And as we're talking about things to do with youth, that has to have an internet access, of course, but if you do have any younger people following any of your social media, making sure that they're thinking about mental health as well, putting out some of those things, but again, that's for all ages, that could be helpful for. So thank you for that.
Hi, this is Amanda again. Words. Sorry. One thing that we have been recommending is meditation, and there are quite a few places that are offering free guided meditations for even 10, 20 minutes. One of them is Jay Shetty, Shetty, and if you just Google him, you'll find he's doing a 20-minute guided meditation every day at 12:30 Eastern. And then there's also, I can put it in the message, but there's a one at Yale University called the Happiness Project that everybody can access for free right now too.
Awesome, I love that.
It's really powerful to be. I mean, Jay Shetty in particular is doing it worldwide. So you're actually doing a guided meditation with a whole lot of people around the world at the same time, and it's quite an experience.
That is really, I bet that's just a cool energy to have on that, even being disconnected.
I don't want to do yoga over no TV.
Okay, so I also see some people have dropped in some links for different resources, and that's something else that there was a call, that Mary did last week, I think, And there was a lot of recreational activities that were listed, and we have dropped those on our website if you want to give a check out to any of those. Of options just to play games with somebody else, there's ways to do that over the internet as well, even by phone sometimes. So just keeping some of those activities going are really great ways to keep us a little bit in check and also provide us that break. Oh, Mary has dropped it into the chat, the electronic resources, so perfect. What has everybody else done? What are some other programs that you're doing and that you're running and you're still able to keep up and going? Or what questions do you have right now that we can maybe troubleshoot to the group?
While folks are thinking, I just wanted to say aloha. I'm reading from the chat. They said that they're using this time to catch up on staff development or individual training related to our programs. And that is a great way to do it. I did see a message come out from ACL that said, you know, take this time if you can to have staff do some development time. There's tons of archived presentations on the IRU website, and I know April and Nicole have done some. This might be a good time also to go through your policies and procedures and you know, put down some of the curriculums you're teaching, put them down on paper. Take this time to do that work you've been pushing off to the side for the last several months, which I know many of us have been doing. What else? Oh, go ahead.
Hi, this is Susie Malloy. I'm in Arizona, and I've been noticing some interesting things. One of them is that the situation is emphasizing and re-emphasizing the alienation that people with chemical and electrical sensitivities feel from the independent living centers and the rest of society. People are just isolating and scared, or isolating and mad, or things like that. Most of our communication tends to be over landline phones, or some of us have computers and we can do old-fashioned email, but we don't have Facebook, and we don't have, a lot of us have lived for years without computers, and I'm really happy for the people for whom the computers are working so well. And it's just really great. It's just we can't use them that way. So I'm feeling that divide sort of between the rest of the independent living folks and us is just, you know, deeper than ever. On the other hand, there have been some really fascinating bridges built that I wouldn't have expected. Like, one of them is that, I've had to stay in touch with some judges and attorneys down in Phoenix on behalf of consumers. And they're people who have never been outgoing before or shared anything about themselves, as though they really value their professional distancing. And it's, since we do so much on paper and pen or things like that, or just by plain old-fashioned mail, it's been just unique that some of the judges and attorneys have been giving us their home addresses and saying, well, don't write to the office, just send me this or that at my house and I'll get back to you. And it's been such an icebreaker with so many people who had, you know, I always felt kept us at arm's distance or something before. So that's been really fascinating to me.
Thank you. That's great. I also just wanted to add real quick from the chat, somebody had a question about whether or not Zoom was free. And I just wanted to tell you that Zoom does have a free plan. It only allows you to do 45-minute interval meetings, and then it'll kick you out. And then, I'm sorry. And then after that, they do have some basic plans. And I just wanted to recommend to everybody, if you don't have a TechSoup account, you can get Zoom through TechSoup, and it's way cheaper than just purchasing it. So I know Scott just did that in Minot. Scott, do you remember about how much it costs through TechSoup?
I'll look quick, Mary, and I'll drop it into the comments. So it was, I think it was
Wonderful.
half price though, so.
Great. Great. Anybody else have questions or thoughts? This has been such a useful call, you guys, by the way. I'm going to record this and save the chat, and we're going to try to compile as much as we can and put some materials together for you all.
Hey, Mary.
Oh, go ahead.
Mary, this is Lou Ann Kibbe with Southeast Kansas Independent Living. And one of the things that we're working on doing kind of falls in with what Susan was saying about technology. I mean, I guess a lot of people have been talking not having internet service for customers and such. So in Southeast Kansas is probably one of the poorest, not the poorest area of the state. Of the state of Kansas. And so one of the things that we developed that we're working on is, and I've shared this with other centers, I'm happy to share it with others. I've shared it with Paula McElwee. And it's a questionnaire. We're going to call every one of our customers, working on doing that actually now, calling every one of our customers and just to check in on them, to see if they live alone, you know, do they have the food they need for a few weeks, medical supplies, prescriptions, do they feel safe, are they scared, and a lot of that, or is there any other resources that they are using locally that they know of, because we cover such a large area. There may be resources that we don't even know are occurring, and so we felt like, you know, if we find individuals who you know, attendant isn't showing up, we can help them find attendants. If they don't have the food, we can help find resources. If they tell us about resources, then we can share those resources with other people. I mean, it's just a huge win. If we have individuals that are alone at home and isolated and scared, we know we need to follow back up with these people. You know, there's going to be others that are doing okay, that have more informal supports, that we may not have to follow up with as often. So we're just working on going through our customers and doing individual contacts. Majority of our people do not have internet service. So we even have people that unfortunately do not have phones. So those of course would take a snail mail service. So, but we're doing our best to try to reach people, have emergency contacts for them. Another thing that we did, Amy Heighton and myself, Amy's the director of Topeka Independent Living Resource Center. We worked up a document for individuals who self-direct their own care. Just kind of some tip sheets with tips on it. You know, you might want to share personal care attendants with individuals, or you know, what, have your attendant be careful about the contacts that they make outside in the community. As soon as they come to your house, directly go wash your hands, just different kinds of tips. And then we also did, attached to that, we did 2 different forms. One form is for the individual customers to fill out with all their personal information. So in case they do get sick and have to go to the hospital, they've got that information compiled and ready to go. And then the second form is a document so that if essential workers are established in your area, and unfortunately if attendants, personal care attendants are not on that list, law enforcement could potentially stop your worker. This form documents with your signature and your contact information as the person that they work for, that you need them to be able to have access to get to your home to help you with your daily needs, period. And they can then, you know, in my situation, they can call me and say, is this your personal care attendant and such. So those are some documents that we've developed here in Kansas that we have been getting out. So I just wanted to share that.
Luann, thank you. That is so important. Is there any way you would be willing to share some of those with us that we can get to the group?
Sure. Yeah, I can. I'm not sure I'm as tech savvy as Sarah dropping that document in there that I already downloaded. But
If you don't mind emailing me, I can
sure.
drop it right in there.
Yep, I can do that.
Perfect. Thank you. Great. You know, speaking of other important services, we've got some questions going on about transportation in the chat. Some folks are wondering, from Arlington, Virginia, how is paratransit services and public transportation running around your area? Some individuals with disabilities must make trips to their medical appointments. And Leah answered that in her area, public transit has just scaled back fixed routes temporarily due to the recent orders issued by Governor Cuomo. And Seth says buses are still running there. So I think that's a good reminder, you know, and how are the paratransits keeping folks safe? Are you guys helping to consult with folks on that?
I know the paratransit in Cedar Rapids has installed plastic shields in between seats so that if you had tried to reach out, that there'd be a barrier between, you know, someone if they were to sit too close to you. And I know that they're controlling how many people they can take on shared rides. So definitely encouraging people to spread out and not kind of group together. And then a lot of buses in our area are completely closing just because I think there's low ridership and they're concerned about financially keeping the buses running. So we're a little concerned about the options for transportation slowly dwindling down for people.
Great, thank you. Luke from Washington is saying that they're also encouraging spaces between seats for those able to enter the back door on the bus. If needed for accessibility, you can still enter the front door. And Scott did get us that answer from TechSoup on Zoom. It was $161 for a year, but that was for 2 licensed hosts, so it's half that for one. Oh, such good info, folks. What else do we want to share or ask questions about?
I did want to share a possible partnership with your local area agency for aging. So you may want to reach out to them to see if you're serving any high-risk consumers that may be food insecure, if there's any way that your area agency for aging would consider dropping eligibility for home meal delivery. We have our local agency who's willing to waive that to get people the food they need to their home with like a 5-day supply of frozen meals, and they're worrying about the financials later. I know that that doesn't necessarily apply to everyone, but it is a possibility to reach out.
Thanks, Sarah. I think at this time, any resources are better than none. I was also wondering, has anybody been using transportation vouchers in response to a limited transit? For example, to pay friends or family for transportation? Maybe not. Leah says, Andrew, that's something we could probably work with our other local charities to obtain from town to town on a case-by-case basis. Great. What else do we need to talk about, folks? I'm so glad that we're doing this, by the way. I knew that there would be so much wealth of information out there. Diana says, Diana is in Montana in the Flathead area, and she said their food bank has a drive-up line today. Workers are taking the food and putting it in trunks for folks. Oh, that's nice. And Seth said that he just called their transit office. As long as the regular buses are running, the paratransit system must also run. This doesn't mean they can't be scaled back, however. How are your SILs doing as far as engaging your employees? Are you guys finding the transition to working from home is going smoothly? Are there things you're still working out? Diana says, our director is in the discovery phase.
I like that. I would say at Access to Independence, we're kind of in that too. I don't think anyone really knows the right answer on how to respond to this. We are all figuring this out one day at a time. And I think if there's any, solace, my staff know that we're all kind of figuring it out together, and we're going to see things that work and things that don't and make adjustments. But everyone has been really awesome with how flexible they've been. And I know, my staff have different challenges. Some people live at home with small children or with families. And so I've pretty much told them, if you can get close to 8 hours of work done throughout a day, it doesn't matter if you have to sit through it all in one go or whatever schedule you need, just make sure that we know and are updated on Google Calendar so that other people can see what you're doing. But I'm really willing to work with anyone to make sure that their needs are being met and work is still getting done. So I really appreciate all this information out there, and I want you to know that we are all in this together. This is really hard, but we're doing it. We're making services work.
That's awesome. I was just checking to see if Luann had sent me that. I forgot to check my email. I wanted to say, Anna Jones says that they are doing as much as possible remotely, including intake. We do have an equipment loan gift program that's still operating on a limited basis with social distancing precautions. And then Lydia was talking about how they're using Zoom meetings with program managers each week so she can give them info to disseminate to their staff. And then they're using their case management system to log all the hours so that they can see what's being done. I think that's great. Somebody asked me the other day, what should I be doing? And I think we're all wondering that. What I told, probably one of the best things you can do is just stay informed, stay on social media, on the internet, like if you can as an employee, to continue to know what's available in your community. I think that we have a lot of helpers that are showing up in our communities. And so if we can just stay on top of knowing what's available and helping consumers access that information, because they may not be as privileged as we are with constant access to information. But that's just kind of my way of my way is to stay informed. That's how I get through a crisis. Sorry, and I have a little helper here who keeps trying to talk.
Mary, there was also, Anna had dropped in possibly remotely including intakes. We have an equipment loan gift program that is still operating on a limited basis with social distancing precautions for pickup. So I think that might have been to that COVID accessibility testing.
Oh, gotcha.
Yeah, there was a question on the accessibility of COVID-19.
Oh, that was the question. That's right, that we kind of skipped over. So the COVID-19 testing in your areas, they were wondering how accessible is it, people in your areas?
It's not.
It's not, yeah. I think that that's something that's happening nationwide. But I wanted to also just mention quick, Lauren Smith is from the RTC. She dropped in their telecom toolbox. It was created for Voc Rehab, but it goes through a lot of telecommunication information, email, video chats, text messaging, a section about ethics, which could be useful when you're putting together policies. Oh, thank you. That is really helpful. Again, we're going to save this chat before we end, and I'm going to try to sift through as much of it as I can in order to get that out to you guys in a more usable format. We do have about 15 minutes left, just to be conscious of the time. Does anybody have any other questions that they didn't get to ask yet?
Hey, Mary, this is Lou Ann. I just sent you those documents.
Thank you. I will pop them in.
Hi, this is Susie Malloy again. I've had this other observation that I'm almost reluctant to share, but that's the way it goes. Despite what I said a few minutes ago about really noticing the digital divide problem between people who can use computers and whatnot and those who can't, there's this other thing I've noticed. It's kind of a leveler, a social leveler, and that is, it's something that surprised me, that for those of us who haven't been able to go to use the independent living centers or work in them or go in as consumers or whatever, it's kind of a social leveler that the employees and our colleagues who work in these places are now at home too. I hadn't noticed the degree to which some of us have a collective chip on our shoulder about the people for whom offices are now accessible and those for whom they're not, because of the chemicals and office equipment and so forth. And that's just something I'm noticing, and I wonder, I guess I'll just keep an eye on myself and see how that develops as we go through this period of really nobody having an office. It kind of reminds me of independent living stuff before there were centers.
Thank you. Sorry, I was in the middle of trying to drop some stuff in the box there. Any other closing comments or thoughts anybody wants to make?
Hi, this is Sarah Ann. I'm also from Arizona, and I work at the Silk. And I just want to say that it's been really helpful that we have an emergency preparedness committee already, and I apologize, my dog is just starting to bark. And then because we were able to utilize that during this time period, and that we already had those connections between our Centers for Independent Living, and then with the Silk, and then us with our state Arizona Department of Health Services. So if you guys aren't participating in any kind of committee, I thought that ended up being really helpful.
Thank you.
And Mary, before we jump off, I just really wanted to share out loud Seth's comment. He said, when I was a boy, I would see scary things in the news. My mother would say to me, look for the helpers. You always find people who are helping. Mr. Rogers, so keep helping, Mary, looking for us. So I just thought that was a good thing to remember.
Oh, I think that is wonderful. You know, I really appreciate everybody who made the call today. We put this together at the very last minute, and look at all the folks that came and joined us. For me, it was one of those, I wanted to be a helper, but I didn't really know what I could do. And all that I can do is make sure that we keep having a space where we can share and know that we're all in this together across the country. I mean, I'll be honest, I have been in tears several times over the last week, just all the changes that are happening and trying to figure out where we're going to go next.
And just a few reminders. Oh, sorry. I was just going to remind everybody, the Youth Coordinators Connect call meets on April 7th if you want to talk about how this is affecting youth programs specifically. And that information is on the April website. And then also just keep a lookout for the advocacy committee. I think some of these conversations about the accessibility of testing and the different accessibility issues that were coming into play with these new settings and new places really can be discussed there too. So we can keep that conversation going, just as a reminder for everybody.
And also we'll make sure that this info gets out on the ILRU listserv with all the resources that everybody's been sharing. I'll save chats. Luke mentions Nickel has an emergency preparedness committee. That's another way you can stay involved. Todd Holloway is the one who runs that. And there's been so many wonderful resources being dropped in here. So we will try to gather as many as we can and get them right back out to you. And if this was useful to you, please let us know. You're welcome to shoot me an email. I'd be happy to hold another one if we think that this is something we want to continue checking in on as the weeks progress. But yeah, thanks everybody again, and we'll be in touch. Everybody stay safe and stay healthy, and let's take care of each other.
Thank you.
Thank you.
Thanks.